My name's Dr. Faris Al-Ramadani. I'm a GP at a surgery in Southam, South Warwickshire called St Wolfston Surgery, and I'm a PCN clinical director. Okay, so the use of digital is something that we've only just looked at and we've only just started with, really. The formation of primary care networks allowed GP practices to work together at a larger scale and take a slightly different approach, maybe looking more at population health and looking at a wider coverage of people. And so that's why we had the idea that we could perhaps look at technology as a way of delivering service to a greater number of people at the same time. So it was trying to find a way that we could get more people more care, but to do it sooner. And that's where digital seemed like a natural alliance, really. Digital allows greater access for a wider number of people, and then we could see the benefits of digital, and those benefits are going to be more people using more services at times that are more convenient to them, and those are things that I think really could benefit our patients. I spoke to a patient yesterday who told me that we were reviewing their medication. They were taking an antidepressant medication and they wanted to come down on their antidepressant medication. I'd asked whether they'd been back in touch with IAPT because they'd had previous encounter with IAPT 2-3 years prior. And they said, no, I just use SilverCloud. And I use SilverCloud and I'm feeling in a better place at the moment. But they said, look, I just needed to go back on the basic values of what I learned when I was with IAPT. I could do it in my own time, but I was able to revisit the things that I'd already learned. And I feel quite strongly that psychological therapies are at the forefront of treating patients with symptoms of anxiety, depression, and also to some degree anyone's health and well-being and mental health and well-being. Giving patients that immediate access is great for the patient. It means they can start their journey almost immediately. So for me, that's really, really good. As a service, that's really good too, because actually if people can start their journey sooner, they can get better sooner, which then puts less demand on NHS services in the long run. And actually it may reduce patients going into a state of higher acuity illness. We can probably catch people sooner, get them better sooner, so things don't escalate to a worse situation. We don't see any of this as a replacement for IAPT, but actually can this support IAPT as a positive adjunct? What we have to realise is there is a shift towards personalised care for patients and individuals, and it's trying to understand what that individual needs and giving them an option, giving them a menu of options so that they can try and find the intervention that works best for them. We cannot treat everybody the same as if everybody's just coming off a conveyor belt. So we need to give people options and choices. So I think it's increasing the number and availability of options for individuals so that we can start to make really positive impacts on their mental health and their well-being.